Today, we're digging into a really big shift in how we think about global health. For decades, the strategy has felt a lot like firefighting, always rushing to put out the latest disease outbreak. But a whole new way of thinking is taking over. What if, instead of just fighting fires, we focused on building fireproof fortresses? Let's get into it. It all kicks off with this one kind of frustrating question. The world keeps setting these massive, ambitious goals for global health. And don't get me wrong, we've made some incredible progress. But there's also this pattern of falling short. So why does this keep happening? Okay, so to really understand the problem, we have to look at the history here. Because this isn't a new thing. It's a cycle that's been playing out for a long, long time. Let's just walk through this for a second. It goes all the way back to 1978 with this incredibly bold goal, health for all by 2000. A huge ambition. Then fast forward to the year 2000, and we get the Millennium Development Goals, the MDGs, and 3 of their 8 main targets were all about health. And then again in 2015. The whole thing evolves into the Sustainable Development Goals. The pattern is crystal clear. We love setting big, bold targets. And yet, this is the reality we keep running into. Even with all that effort and some truly amazing progress, the fact is, many of the countries that need the most help are the ones least likely to actually hit these targets. So what does that tell you? It's not about a lack of trying. It points to something much deeper, something systemic about our whole approach. So what is that systemic problem? Well, more and more, experts are pointing to something called the vertical program trap. It's this whole strategy of fighting diseases one at a time, and it turns out it has some pretty serious hidden costs. Let's be really clear what we mean by a vertical program. Think about those big, famous campaigns for specific diseases like HIV, TB, or malaria. They usually have their own funding, their own dedicated staff, even their own supply chains. They basically operate in a silo, a completely separate vertical slice of the health world cut off from everything else. And this quote from the Pan-African Medical Journal just nails it. All this fragmentation, all these separate programs, they just haven't worked when it comes to building health systems that can last. Sure, you might put out one specific fire, but you're not making the building itself any stronger. And this slide breaks down those hidden costs perfectly. First, you get duplication. You literally have separate trucks delivering supplies to the very same clinic for different programs. It's so inefficient. Then you have distortions. A well-funded program for, say, HIV might offer higher pay, which then pulls all the best nurses away from other vital areas like caring for new mothers. And then there are the disruptions, constant, separate training sessions pulling healthcare workers away from their actual jobs. And finally, you have distractions, the same nurse having to fill out tons of different paperwork for each separate program. It all just weakens the entire system. So if that's the problem, what's the solution? Well, it's a huge shift in mindset towards something called systems thinking. Instead of obsessing over individual diseases, the new goal is to make the entire health system stronger. And you can actually see this new way of thinking just by looking at how our global goals have evolved. Remember the MDGs? They had 3 separate health goals. But now, the new SDGs, they have just one. And that's not a downgrade, not at all. It's a really smart, strategic pivot away from that fragmented approach and towards one unified mission. And here it is. This is the goal. Ensure healthy lives and promote well-being for all at all ages. It's broad. It's for everyone, and there's just no way you can achieve it by focusing on only one disease. You have to build a system that can deliver on that promise for every single person. But, what does strengthening a system actually mean? It sounds a bit abstract. Well, the World Health Organization gives us a really helpful blueprint, these 6 building blocks. You start with good leadership and governance. Then, of course, you need health financing, the money to make it all happen. You need a strong, motivated health workforce. This next one is crucial, health information systems, which really just means good data. You need access to medical products and technologies. And finally, it all comes together with effective service delivery. All right, let's take this out of the world of theory and see what it looks like on the ground. We're going to look at Kazakhstan, a country that went through a massive reform of its entire system. And their story is a fantastic case study, especially when it comes to that 4th building block we just mentioned, health information systems. So as you can see from these numbers, Kazakhstan was facing some pretty big health challenges. You look at things like life expectancy or mortality rates, and compared to its neighbors and other developed nations, well, there was a lot of room for improvement. The government knew they had to do something big. So they set all these ambitious health goals for the country, but here's where they ran into a wall. When researchers actually looked at these goals, they found a ton of them were just vague. A goal like increase healthy life expectancy sounds amazing, but how do you measure that? It's subjective, so it got a red rating. Others were a little better. They got a yellow. Only a few, like decreasing the infant mortality rate, were rated green, clear, simple, and easy to track. And that right there is the heart of the issue. The problem in Kazakhstan wasn't that they weren't ambitious enough, it was a lack of solid data and goals you could actually measure. They were trying to build a better system, but they were doing it without a clear blueprint and without any way to know if they were even making progress. This quote from the United Nations just sums it all up perfectly. Data is the lifeblood of decision-making. If you don't have it, even the best policies and the best intentions are basically just flying blind. And that's exactly why that health information systems building block is so critical. So all of this brings us to what the future of global health looks like. The lesson from all the missed targets of the past and from real-world examples like Kazakhstan is pretty clear. The only way forward is to integrate everything. And it really all comes back to this one incredibly powerful number. One single unified health goal in the SDGs. That one number represents the entire shift in strategy, and it forces us all to think about the big picture. Because the big takeaway here, the thing to really remember, is that the ultimate goal can't just be about wiping out one specific disease. It's about building a system that's robust, that's resilient, that's fair, and that's strong enough to protect everyone's health from everything for a long, long time. It's about building the fortress, not just fighting the fires. Now, this shift in thinking is a huge step in the right direction, but it leaves us with the biggest question of all. What is it really going to take, in terms of money, political willpower, and global teamwork, to finally build health systems that are strong enough for whatever the future throws at us? Thanks for watching.